and you know what to do. After it's over, then there's this
check, call, care, check the scene for safety. For a child, obtain consent from a parent or guardian if present, then check the person for responsiveness. If the person doesn't respond, call for help. If the person is face down, gently roll the person face up, keeping the head, neck, and back in a straight line so you can provide care. Once the person is on her back, open the airway by using the head tilt, chin lift technique. To perform the head tilt, chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back as you lift up on the chin. Maintain this position. For a child, do not tilt the head back as far as you would for an adult. Check for breathing for no more than 10 seconds. Look to see if the person's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. In an unconscious adult, you may detect an irregular, gasping, or shallow breath. This is known as an agonal breath. Do not confuse this with effective breathing. Care for the person as if there is no breathing at all. If an adult is not breathing, quickly check for severe bleeding, then begin chest compressions. If a child is not breathing, give 2 rescue breaths, one after the other, before checking for bleeding and giving care for the conditions you find. Use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the child's mouth. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the child's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If at any time an unconscious person begins vomiting, the airway could become blocked. Roll the person onto one side, and then use a finger to clear out the mouth. Once the mouth is clear, continue to provide care based on the conditions you find. If the person is unconscious but breathing, maintain an open airway with the head tilt, chin lift technique, and monitor breathing and for any changes in condition until EMS personnel take over. If you cannot maintain an open and clear airway because of fluids or vomit, place the person in a modified Haines recovery position by moving the person to her side while keeping the head, neck, and back in a straight line with the knees bent. If you need to leave the scene to call 911, modify this position by tucking the hand under the head. If you encounter an infant who appears to be unconscious, follow the emergency action steps: check, call, care. First, check the scene for safety. Obtain consent from a parent or guardian if present. Then, check the infant for responsiveness.
Baby.
If the infant doesn't respond, call for help.
Call 911, this baby's unconscious.
With the infant on his back, open the airway by using the head tilt, chin lift technique. To perform the head tilt, chin lift technique, place one hand on the forehead and 2 fingers on the bony part of the chin. Then tilt the head back slightly as you lift up on the chin. Maintain this neutral position where the head and chin are neither flexed downward nor extended backward. Check for breathing for no more than 10 seconds. Look to see if the infant's chest clearly rises and falls. Listen for escaping air from the mouth and nose. Feel for escaping air against the side of your face. Normal, effective breathing is quiet, regular, and effortless. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then make a complete seal over the infant's mouth and nose. Blow gently for about 1 second. Each breath should make the chest clearly rise. If the chest does not rise, re-tilt the infant's head and try another rescue breath. After 2 successful rescue breaths, quickly scan the body for severe bleeding and care for the conditions you find. If the infant is unconscious and breathing, maintain an open airway and monitor breathing and for any changes in condition until EMS personnel take over. Shock is a life-threatening condition that occurs when a person's body is struggling to meet demands for oxygen and blood supply. The signals of shock present themselves in different parts of the body. The person can feel apprehensive or anxious in the early stages of shock, then grow listless and confused and be unable to speak as shock worsens. Breathing might start at a rapid rate, then become slow, shallow, and irregular if shock progresses. Body temperature will decrease slightly at first. As shock worsens, body temperature will drop much lower than normal. Skin will feel cool and appear ashen or pale, then grow colder, paler, and clammy. Pulse rate will increase slightly in the early stages of shock, and change to rapid, weak, and irregular as time elapses. As shock worsens, the person's organs can shut down, which can cause death. Calling 911 immediately and minimizing shock can save a person's life. Here are some steps to minimize shock. Make sure that 911 or the local emergency number has been called. Have the person lie down. Since you may not be sure of the person's condition, leave him or her lying flat. Control any external bleeding. Help maintain normal body temperature. Reassure the person until a trained responder or EMS personnel take over. Don't give the person anything to eat or drink, and monitor the person for changes in condition. Ready to practice CPR. Position yourself next to the mannequin with your gloves on and your CPR breathing barrier ready. First, place the heel of one hand in the center of the chest along the breastbone. Then, place the other hand on top and lace your fingers together. Position your shoulders directly over your hands. Keep your arms as straight as possible and your fingers up and off the chest. Push hard and fast in the middle of the chest, at least 2 inches deep. Now, give 30 chest compressions. Try to keep an even pace. The compression should be at a rate of at least 100 per minute. Counting out loud can help you. Ready? Go. Each compression should be smooth. Let the chest rise completely before it. Okay? Stop. Give another full set of 30 compressions. Remember.
So for your baby, you would put one on the front and one on the back.
One here. One here.
On the adults, yes. On the infant, turn it on.
Analyzing heart rhythm. Do not touch the patient.
So I'm clear, you're clear, we're all clear.
Shock advised.
So it's telling her to shock her patient.
Charging.
It'll tell you when.
Stay clear of patient.
So you're saying it again, I'm clear, you're clear, we're all
Deliver
clear.
shock now.
So then she
Shock
pushes the button to
delivered.
shock the patient, then you immediately start
Begin
hovering.
CPR.
It'll talk you through the whole thing. And you keep doing your compressions and your breaths until it tells you to stop, or if it says it's analyzing the rhythm again, and then it'll tell you when to start compressions again.
Okay.
Just, I know you guys will get worn out, but I'll bring this around so everybody can have an opportunity to see how.
What's up, man? Yo. Hello, Candace. So this vlog's a little bit weird. I didn't do an intro because I didn't know how today was gonna go, but we just got done doing our CPR training, so yeah. And we just took our tests for that, so fingers crossed we passed.
Yes.
And we can become CPR certified.
Yes.
I'm really nervous about that, but
Compressions is harder than it looked.
yeah, compressions are really hard to do on the mannequins and stuff, but I mean, it's just to give us a general idea of what it's going to be like if we have to perform CPR. So
Yeah. But pediatrics, it was a lot easier than the adult.
yeah, but all right, man. So yeah, technically it was day day 3, technically day 3 of our MA clinicals because we had a week off because of things happened, you know. So whatever, it is what it is. It's really nice out. Yeah, that's just an update. Just did our CPR training. I'm about to go get some food.
Me too. I'm gonna cook my food.
Here. But yeah, y'all, we'll see y'all in the next one.
Yep.
Bye-bye.